Thunder Bay District Health Unit wants to thank you, our community and social service partners. We recognize the important work you do every day to support people in our community.
Over the past several years, you have already played an important role in helping us respond to TB by supporting clients through testing, sharing information, and working with us during contact follow-up.
Your partnership has made a real difference, and your continued involvement is essential as we work together to reduce TB in Thunder Bay.
Tuberculosis, or TB, is an infectious disease that usually affects the lungs, but can also affect other parts of the body. There are two types of TB: active TB disease, when a person feels sick and can spread TB to others, and latent TB infection, when the germs are sleeping in the body and the person does not feel sick and cannot spread TB to others. There is treatment available for both types. People with active TB disease may have symptoms such as a long-lasting cough, unexplained weight loss, fever, chills, or night sweats, and even coughing up blood.
When someone has active TB disease in their lungs, they may spread TB to others, sometimes before they even realize what is causing their symptoms. TB germs are spread through the air when the person talks, coughs, and sneezes. The germs are so small that they can circulate in the air, especially in spaces with poor ventilation. People who have spent a lot of time in the same room, house, or indoor airspace may become infected when they breathe in the TB germs over time. It usually requires longer periods of indoor exposure.
The good news is that most people who are exposed to TB germs do not become sick. In fact, most people who become infected develop latent TB infection, meaning the germs are inactive or sleeping in the body. People with latent TB feel well and cannot spread the TB to others. Without treatment, latent TB can wake up later and turn into active disease. In fact, some people take years for symptoms to develop, and some do not ever develop symptoms.
Anyone can get TB. In Thunder Bay, we know that TB is currently affecting certain groups more than others due to factors like living conditions, access to care, and prolonged indoor exposure. That's why we are continuing to share this information, to support service providers working closely with people who may be at higher risk. For most people in the general public, the risk of TB remains low, and the best way to prevent its spread is early diagnosis and treatment.
As community service providers, you know your clients well. You've built trust and relationships that make a real difference. You're often the first to notice when someone isn't feeling well. By encouraging clients with TB symptoms to seek care, supporting them through testing and treatment, and helping reduce stigma, you play a key role in reducing TB in our community. When someone is diagnosed with infectious TB, the Thunder Bay District Health Unit takes the lead on contact follow-up. We work to identify people who may have prolonged indoor exposure, assess their level of risk, and arrange testing if needed. If you've been identified as a close contact to someone with infectious TB, the health unit will contact you directly. Casual contact, such as brief interactions, is very unlikely to result in infection.
Sometimes a client may say, "I have TB." This could mean they had TB in the past and completed treatment, they have latent TB infection, which is not contagious, or they are currently being treated and are no longer infectious. If you're unsure, contact the health unit before making decisions about service access. People with active TB who start treatment quickly become non-infectious. When someone is safe to return to work, shelter, or programs, the health unit will confirm this. Once cleared, they do not pose a risk to others.
TB is preventable, TB is treatable, and we can reduce it together. If you have questions or concerns about TB, contact the Thunder Bay District Health Unit.